All right, everyone. This is State Representative Tim Miller, and welcome to this episode of Miller Time. I apologize for not being available last week at a meeting that came up that I needed to address. Now, I will ask, so I'm trying to do something new here. As you can see, I have my new background behind me, and that's because I'm working out of my house again. I was supposed to have new Wi-Fi in my house this morning from Frontier, and then they just decided to push it until tomorrow, but I had already committed to doing this show, and I didn't want to pack everything up and go over to my friend. I've been watching the internet speed here. It's been pretty good. It has had a couple of moments, so I apologize if there's any troubles. I really do ask that you comment quickly, especially if you're having problems hearing me. If you don't get to see me consistently, we'll just work through that. And if this becomes for some reason a total dumpster fire, then we'll probably just fire it back up again tomorrow night, not regularly scheduled time. So I see that there's some people that are starting to watch, so welcome. Again, comment often. If nothing else, it's my way of understanding that people are still there and that my chat is working. So hopefully we will get all these things smoothed out real soon. Get little bits and pieces. It's amazing how great this technology is, but it's always amazing how there's some little wrinkle that kind of messes things up. And during these very trying times, that's certainly the case. So again, I'm State Representative. Hi, Lily. Thanks for being on. Everything looks good. Lily, if you could, you're going to be my barometer then. If you can't hear me or something like that, just let me know. Again, I think worst case, and I can see this, I think the video might jump a little bit, but I think the audio might be okay. Next week, again, I will have much more consistent internet streaming, and the problem should be in the rearview mirror, and we can start getting a little more consistent and do a little bit extra things on here that I want to share. Any of you that have been doing Zoom, you know. I'm going to take my glasses off. There's too much glare. Any of you that have been on Zoom knows that there's kind of some cool things that you can do on that program, and I'd like to do some similar things here. It takes a little bit more work with the way I have this set up, but I'll be able to show you screens and things like that real soon. So I'm going to get rolling right into it tonight. If you looked at my preview, whether it was on Facebook or somewhere else, or you just saw that we're going to be talking about COVID again. That's probably going to be a primary subject for quite a while, and especially since there's new news every day. So here in Minnesota, Governor Walz, under his executive powers, peacetime executive powers, he just extended once again the stay at home. He extended it to May 14th, and it was troubling for me that he extended it to May 4th, and I'm going to touch on that a little bit. I'm also going to bring up a couple things that concern me, but I really do. I'm going to count on you in the chat room to steer me if there's things you want to talk about. It's going to be related to this tonight, so if you have something on a different issue, hopefully we can get to that next week. But there's a lot to talk about today and tonight, and I certainly want to get to that right away. So without further ado, again, welcome to Miller Time. I'm State Representative Tim Miller from 17A in Minnesota. And this is a chance for me to talk about issues that are important to my district and the state of Minnesota. And that's certainly what we're going to be talking about tonight with COVID. So the first big piece of news, and Eatmeister, I know, said thank you for getting that resolution started. Let me explain what that is, because that will probably steer a lot of the conversation from here going forward. So as I said, the Governor Walz here of Minnesota extended the stay-at-home order through May 14th, and some people have been starting to ask, how long can he do this? Well, that's a big topic of discussion because we have a conflict in our current Minnesota law. For peacetime emergency orders, and I'm going to simplify a little bit to get to what's important to you, but basically he can do it for the first 30 days and the legislature has no voice. Now, one part of statute says after 30 days he has to get permission from the legislature to continue. Another part of statute says that the legislature has to stop a continuance, or he can continue it for another 30 days. And this is a contradiction that has to be fixed, but we can't fix it right now. So we're just going to move forward with this. And the governor, and I confess somewhat rightly so, has chosen to take the statute that where the legislature has to stop him. Now, he chose that to his benefit, but the reality is this peacetime executive powers is stated in that portion of statute, whereas the statute where it talks about ending after 30 days, believe it or not, peacetime emergency powers is not stated. So he's going down the right lane, and I've talked to the top person in nonpartisan House research, which means he's nonpartisan. He's just telling us what the law says. And he's been around there for, I think, 30 years. So he knows what he's talking about. And he said the way it's written, the governor is well within his powers. However, he also told us something important, too, that he, too, is concerned about these rather extreme powers and how difficult it is to have this end. And so his name is Pat McCormick. And Pat helped us put together a resolution, and this is the way that we do it. It's a joint House and Senate resolution that has a lot of the whereases, and it's whereas there was a time for this peacetime emergency, and whereas we've worked together and given money to the medical field and all that, all those different things. The resolution is be it resolved effectively. I don't have the words in front of me. You can probably look it up on the New House Republican Caucus Facebook page. We have it there. I think we have it on our website too, newhousegop.com. And what we basically say is executive powers have to end now. So we've presented that today. Procedurally, we go into session tomorrow. House and Senate go into session. And there are rules in the House. And we're going back into those rules. For the last 30 days, we've operated under a mutual agreement that the rules were a little bit different, but the regular rules start back into full speed tomorrow. And any bill has to be read 3 times over 3 days, which is good. That's how we make sure that the public knows about it. That makes sure that we know how to move forward in a proper procedure. But there's also a process that is often used in the House and Senate where we suspend those rules. Now, to suspend the rules in the legislature, in the Minnesota House of Representatives, to suspend the rules, you need 2/3 of the state representatives to vote for it. 2/3 of those that are voting. And with the way that we have voting set up where you can either be in the chamber or you can be by phone, we have pretty much full participation. A week and a half ago, we had 134 out of 134, and I expect that. So at 134, I believe that's 90 votes. We need 90 votes to suspend the rules so that it gives this bill the first, second, and third reading. That'll be our first vote tomorrow. That's going to be a tough haul to get 90 votes because you're going to need Republican and Democrat votes. Republicans are in the minority, and I'm pretty assured that the Democrats will probably not vote for this. So we might not get it suspended tomorrow. And we want it done as soon as possible, but understand that's okay. I mean, we want this done, but there is process. And by the way, my biggest argument for why we're doing this is that we have a constitution, that we have rules in the legislation, that we have separation of powers, that we have all of that stuff so that good law proceeds out of that. So for me to say I want good law to proceed and get away from the emergency powers, but we got to stop the presses and get this all done right away, it's a tough argument for me. But we certainly need to get this done quickly. And we can do that over the next handful of days, maybe within a week we can do that. So we are presenting that resolution. I'm signed on to it. So are the fellow members of the New House Republican Caucus. Now, I want to be clear, there's other Republicans that I believe either do want to or will sign on to our resolution. But this resolution was written in what's called the revisor's office. They write our legal, how we say things. And they got it to us very late. They got it to us at 11:30, and the deadline to submit it was noon. So we had to move quickly and then kind of talk to people afterwards. But by now, I'm sure that the entire legislature has heard about it because I've been seeing calls and emails and posts and stuff like that coming out. So they will have time. I had one legislator already text me tonight and ask me some questions about it. So I certainly hope that it doesn't go to the extent of just the four of us. I think this is a good bill. In the Senate, I don't know what's going on now. I know that we were going to present it to a couple senators to consider submitting. I'm not even clear if that's happened because a lot of stuff happens quickly right now. But I certainly hope that we can find someone to bring this up. For the people that want this done tomorrow, folks, it's not going to happen. First of all, procedurally, that's very difficult. Second of all, this resolution, and I want to be clear on this, the resolution does end the emergency peacetime powers of the governor. And I think more and more people are very much in support of that, particularly since he extended the stay at home for another couple weeks or 10 days, I guess, technically, from where he had it before through May 14th. But understand that under those emergency powers, he did do some things that are important. Some of the stuff related to hospitals and clinics, daycares. There's a lot of licensing. We're a very regulated state with lots of licenses and lots of permitting. A lot of that was suspended. There are some delays on reporting, filing for taxes. There are things that do need to continue. So don't get me wrong. We're not just looking to wipe everything out, okay? Even, let me make a point here, even the stay-at-home order, okay? There may be valid reasons. I don't agree with it, but there may be valid reasons why that continues. However, here's the key point. The way that we have set up in our separation of powers of an executive branch, a legislative branch, and a judicial branch, it's the legislative branch that's responsible for writing and passing laws. And then for the governor to either sign or veto. That's his check and balance there. What's happened in the executive orders is the governor has legislated all these things on his own. Now, again, some of it is important things that we need to continue. So the reason why there might be a little bit of a delay in this is that we need to get those bills in order so that we can make sure that when the executive orders end, some of these very important, vital things that we are currently doing that are important don't end. And we may continue to stay at home, okay? But that's going to be for 134 state representatives and 67 senators to decide, not one governor. You see where I'm going with that? So that's going to happen tomorrow. Stay tuned. Talk to your legislator. If I'm your legislator, you can talk to me. Over in the Senate, if you call your senator, understand that they may not be as far along, okay? We've notified some senators what's going on so that they can know. We've told leadership over there what's going on so that they're not surprised. But in fairness to them, they may not be prepared, but hopefully they will work on this. So as you communicate with legislators, be sensitive to that fact that it's not easy to just do what we want to do, which, by the way, is a good thing for all of you. For the citizens of Minnesota, it's good that we just don't do what we do. But again, here's the problem. When the governor has executive orders, then he pretty much can do what he wants to do, and that has to change. So I'm going to look at a couple of the comments here. My eyes are getting old enough. And I don't have cheaters, so I'm just going to throw on my trifocals here because I told you I want your input, and I haven't given you a chance for that. Before I get to the input, I want to talk about some concerns that I do see coming out of this in a little bit of what's been going on in general, and I want to give you a couple things to think about. But let me first look here. E-Meister, yep, thank you. Resolution chip working good. Would you review Governor Walz's extension of his emergency powers? So, Chip, I think what you're at, tell me if I'm saying this wrong, but have I reviewed or will I review? Certainly. We get updates. We get these EOs, they're called, and they're literally 1 through, I think we're at about 32, and we get an update on those. Pretty common language. You can actually probably Google Minnesota governor executive orders, and there's some place in government that those are posted in the governor's office somewhere. You'll be able to find each and every one of those, and they're not complicated. Some of them are a little bit in the weeds of we empower Department of Human Services to expedite some things with counties that do need to be expedited. So you might not recognize what they're talking about, but you'll kind of get an idea of what it is that they're doing. But certainly, if we proceed forward with ending, the legislature is empowered to end his executive powers right now. We have that authority in the House and Senate under our current law. So as we proceed forward with that, we will have to review his executive orders, and we'll have to legislate out which ones should be kept and which ones should be not kept. Now, if you get pushback on this, or I get pushback on this, what they're going to say is there's no time for that. Well, there is time for that. There's a procedure, and it might take days, but it's not going to take weeks. We can certainly go through this. We can come to an agreement, and as your legislature, we can certainly approve the things. If we need people to, not get stuck in a bad position with their banking or with a student loan, or they can't get medications because of some reason, I think everyone can agree that we need to continue some of that stuff right now. But understand also, under these executive orders, a lot of that has already been executed on. The majority of the early executive orders were meant to expedite or break down barriers. We're there already. So anyway, with the hospitals empty and medical staff being laid off or furloughed, do the current stats support the stay-at-home extension? The numbers don't seem to track. Keith, this is a really key point. Now, let me first be clear of one thing, and then I'll give you my response to that. We have a real big problem, and it's what's causing a lot of what we're doing now. We aren't testing people. So we really don't know where the disease is, how bad it is in some areas. Quite honestly, the only way we know is through hospitalizations and then unfortunately death. So what we've done is we've gone to modeling. Now here's the point, probably where the rub comes between someone like me and the governor. It's what modeling do you use? Now, the governor is saying that he's using modeling from the University of Minnesota and experts there and experts in healthcare here in Minnesota. He's been incredibly vague up until just the last day or two. And there was actually a online hearing or discussion to understand how they're modeling. But his modeling, remember, stated there'd be 74,000 deaths if we did nothing. And his current number is he's projecting that there's going to be 22,000 deaths in Minnesota. Well, we're not seeing anecdotal evidence of that, right? More importantly, we aren't seeing real evidence. So there's a model, and I'm going to throw it up in the chat room. Okay, some of you know about this. Some of you know about this modeling. Some of you may not. But the University of Washington made a model. You can see it at this website that I just sent. You can actually see every state there if you want, but I have Minnesota linked right now. If you go see that, they have modeling for what's going on in each of the 50 states. And I was told that Bill Gates, I forgot his name for a second, that Bill Gates funded putting this together. I can't confirm that. Would make sense since it's University of Washington. But in any case, that's what I was told. But they put together this model. Now, this model that they put together is based on more information than what we had in the past. It's with actual data being collected now. And then they're modeling off of that. So again, it's not dead on accurate, but if you go to this site, you will see the modeling be more consistent with what you're seeing and what you're witnessing than the numbers that Governor Walz is showing. So if you go to the site, and I'm not going to refer to it, I wish I was up and ready to go to show this screen to you, but I'm not. But just to give you a couple numbers, with this model, the total deaths in Minnesota is projected to be 442, beginning, middle, and end. 442. That's a lot different from 22,000. It says we're going to need 127 ICU beds at its peak, which is a very important thing to look at. We have 355. So I won't go through this whole thing. Take a look at it. You'll learn a lot of information there. But understand that this model from the University of Washington is proving to be very consistent with what we're really seeing. So at the very least, we should take a serious look at it and maybe have our policies based off of that. So, Keith, when you go to with the hospitals empty and medical staff being laid off or furloughed, do the current stats support the stay at home? My personal answer is no. Okay, I don't support the stay at home anymore. I think it served its purpose that they were stating to flatten the curve. Curve is definitely flattened. It's lower. Here's another thing is I've had a medical doctor and a couple nurses tell me, and I won't go deep into this week for the sake of time, but I've had some medical professionals say that understand there's a cost, a health cost. There's a health cost to people being in their house for an extended period of time, under stress, losing money, not knowing how their bills are going to be paid, getting sick of the kids, whatever. That lowers your immune system. And they argue that at some point you start losing the benefits of stay at home, and you actually start increasing the chance that if someone contracts this, that they can contract it in a very serious, dangerous way. Okay? So there's not even consistent agreement that staying at home is going to do much more than it's already done. And certainly it's affecting our economy. It's affecting mental health. There's so many different things in personally, I don't believe that the governor is taking that into account serious enough. I'm sorry, but his actions are not consistent with that. And when he extends stay at home, he just says, because we need to save lives. You want to save lives, don't you? Well, that's not a fair proposition, because who's going to say, no, I don't want to save lives? No, that's ridiculous, right? But in the totality, we need to make very serious considerations of all these things, and not just in a vacuum of, do I want to save one life or not? So anyway, so it's not supporting it. Another thing, there's a few of us that have written a letter to, when you talk about hospitals, Keith, we wrote a letter to the governor. Right now, there is no elective surgeries going on. Well, that's a broad brush, and there's people that need certainly health-related, chronic health-related, and in cases, some life-saving related surgeries that are being delayed. And we find that to not be acceptable. There's plenty of medical staff that are proving at the ready and available, and we can do isolated out places where they can do these procedures. And so there's a group of us that wrote a letter to the governor stating change the executive orders. So anyway, if we don't have executive orders, and we can do that in the legislature and take care of it that way too, which is what I'd rather do. So Eatmeister says, reading the statute to say he has 60 days is generous reading and abandons all logic. Eatmeister, I don't disagree with you. All I'm telling you is that's what the legal professionals are telling us. Actually, 60 days is nothing. The legal professionals say he may have standing. They don't know yet, but he may have standing to keep this going through July. So stay tuned on that, okay? Why do you think I wanted this resolution? Oh, okay, that was the extension of that. So Lily, yeah, Bill Gates, but he also has the wherewithal to create pretty incredible software. And if you go to this website, it's pretty impressive. Lily says, I'm personally really tired of my non-essential dentist appointments keep getting rescheduled. And Lily, that's, let me be clear on something. I do think that what's going on right now, for the sake of some people, we need to socially distance. We need to be smart with how we do things. But guess what? There are ways that we can be safe. There's ways that we can be smart, okay? That don't include just locking the doors of businesses and then keeping us at home. That's very kind of, what's the word I'm looking for? That's just very simplistic. There are other solutions. And I think that there's actually a way that we, dentists, okay, the dentist would have to say, here's what we're doing and how we can do it. And I guess I would want to know that, but I'm sure they could figure something out. But what about cutting hair? Do you think we couldn't cut hair? My son Jacob needed a haircut a week ago, and now we're looking at another 5 weeks before he can get his haircut. I don't think that's responsible. I think that we can get the people that cut hair back to work. So I agree. I also think that with the essential and not essential, there are some, and this was going to happen, but there's some absurdities associated with that. The governor last week did open up the doors to some businesses, but I think there's others that we need to open as well. So, Meister, I'd rather 1,000 people die from free choices than one saved by tyrannical and iron-fisted government. I agree with you, Meister, and that's something that we need to ask as a nation, because as a free person, you increase your risk. That's the reality. As a free person, you increase the risk to your own health and welfare, possibly to others. And we as a nation are going to have to really look hard at ourselves, because right now we're saying, Governor, you can do whatever you want for as long as you want, just keep me safe. Well, there's two problems with that. Number one, that's one person having all the power, which is not good. And here's a more important thing. There's no proof that what he's doing is working. Now, it might be helping. I certainly think that it probably is helping, but there's no proof. Why? Because we aren't testing. So we don't know. You look over to South Dakota, and unless they just did it in the last day or so, they have not implemented any of these things, and their numbers are lower. And you can say, well, that's South Dakota, less population. Not for most of our state, it's not. Most of our state, once you get outside the Twin Cities, is very similar to South Dakota. Okay? And their numbers were, as of a couple days ago, even a little bit better. So it's at least something to contemplate and talk about. Keith, thank you for your explanation website. I agree with your viewpoint. Let's cut this short and get back to work. Yeah, and Keith, that's our message, is it's time to allow people the freedom to get back to work, for people to do things. Probably my biggest challenge in all of this is a real basic conservative principle that's getting lost in all this. And that politically conservative principle is trust the people more than you trust government. You know, Ronald Reagan, one of his quotes, he said a lot of things on this, but one of them has been said many times over. There's no worse thing that you can hear at your door than, hi, I'm the government and I'm here to help. Or that government isn't the solution to the problem, it is the problem. I think I butchered that quote, but it's basically that. Okay? There is this presumption right now the government can and will keep everyone safe. Okay? Government certainly has through public safety, has the public's interest in mind, but that's from enemies, foreign and domestic. Okay? Now, people that are supporting this would say, well, this disease is an enemy. Well, they make a point, but at what cost to our freedoms do we make these choices, like I said earlier? So I think that it's time to trust the people. I think it was always time to trust the people. You know, back when they closed the restaurants, I said, I don't know that you need to close the restaurants. You just need to say, follow these practices. No more than 10 people in the dining room at a time. You have to go through these draconian measures for cleanliness that are way above and beyond. I think most business owners would, at the very least, say, let me have that choice. They may not decide to be open if it becomes too difficult, but at least I have a choice. But chances are they would say they would take that over just being shut down and being told they can't be open. Which, as a reminder, support your local restaurants and order. Jacob and I went and picked up some dinner together, and we sat in a big empty parking lot and enjoyed it together. A little bit of it was to get away and give Jacob something to do, support a local business, but also my wife Sherry had a test. She had to take it home. So having me and Jacob in the house wasn't conducive for that. So Barb, absolutely give me liberty or give me death. That's the fundamental principle for us here in the U.S., right? So I want to touch on two more things, and then if there's no more questions, we'll probably wrap up with this for now. And I hope this has been okay. People keep responding, so you must be at least hearing me. Again, next week, we'll have better internet in my house. I'm better set up here to do the fancy things I've wanted to do for a long time, and so we'll be doing that hopefully as early as next week. We'll start integrating some of that. But the two things that I want to address to close this is the big argument for everything we've been doing is for the safety of people, okay? And that's a valid argument. But for the safety of people, we say everything's an emergency, everything's a rush. We have to be really fast with this, that, and the other thing. And there have been some things we've had to do. Although, as a pause, understand the very first thing we did was we approved $250 million for hospitals and clinics. And I can't tell you today, but I can tell you how much was spent 2 days ago. It's an easy number to remember. As of 2 days ago, the $250 million that we expedited out, and I think we should have, Zero of it has been spent, which is good news, right? We're keeping things well in order and well under control. But we have passed some other things for the sake of it's an emergency and we have to rush and do this. One of the things that I have really been stressing to people that I talk to is when there's emergencies, when there's stress, when there's crisis, the first thing that people want to do is abandon the basic principles that we abide by. You know, in our household, if there's a crisis, don't worry about kids getting to school on time. Don't worry about the money we spend out of savings, you know, all hands on deck sort of thing. We just kind of, you know, whatever. We just kind of break the rules. Well, that's a household. It really doesn't change, folks. We have even more so, we have a constitution. We have basic principles of what makes our society, and its process, it's sticking to the rules. And the point that I want to make is that when we are in a crisis in difficult times, that's even more so the time that we adhere to those principles and we stick close to the Constitution. So that's why I've been raising these questions. I've sounded like an old fuddy-duddy. I've sounded like a person that just wants to complain about everything the governor does. But someone has to speak up. Someone has to oppose when we see our rights being infringed. Somebody's got to do that. And I'm certainly going to do it because I see it, and I'm not afraid to do it. So one of those rights, and this is what I'm going to close with, it's kind of a big one. But I'm out of information after this, and unless someone has a question they want to throw up here, I'm going to wrap up here after this. But here's a real specific example of what I'm talking about. We had Easter this Sunday, yesterday, okay? I'm a Christian man. I'm thankful for my Redeemer coming and being born, living a perfect life, dying on a cross, even though it was my fault, and saving me from my sins, okay? The basic gospel, okay? There are churches that adhere to many things throughout the year, whether it be traditions or like in the Catholic faith, the Eucharist is something that's absolutely sacred that has to be done. So what happens during times like this? Well, I want to be really, really clear here. Hear me out, okay? The governor was coming across. I had someone that wrote me an email, and he said, I belong to a Lutheran church, and we have communion on Thursday, Monday, Thursday. I understand that. I grew up a Lutheran boy myself, and they have communion. And he said, we are being told that we cannot have communion. Right there? Okay. But who's telling you you can't have communion? Is the church telling you can't have communion? Leadership. I'm okay with that. Okay. But they were saying, no, we're being told the governor is saying that we can't have communion. And I was like, well, I know no one wants you to get together, but I can't believe he stepped over that. So I emailed the governor's office, and I got a response. And I asked him specifically, are you saying that people cannot legally have a church service, legally cannot have communion together? It was a yes-no question, and they came back with, well, in these emergency times, people need to not come together like that, not do communion and stuff like that. If they do, it'll be a misdemeanor with $1,000 fine or up to 90 days in jail. Folks, that is in such direct violation of the First Amendment. I can't say that enough. 'Cause let me read it to you. Should I had this up? So listen, and I'm going to read the whole First Amendment. It's important to read these, okay? So Congress shall make no law respecting an establishment of religion or prohibiting the free exercise thereof, or abridging the freedom of speech or of the press, or the right of the people peaceably to assemble and to petition the government for a redress of grievances. Folks, right now, under these executive orders, other than freedom of speech or the press, I suppose, the rest of those are being suspended. You can't even petition the government for redress of grievances right now because all of that's been suspended because of what's going on. This is hugely concerning to me. Now, I want to be clear. I do think social distancing is important. I do think we put people at risk, especially the elderly, if we are to have things like communion and church service. I do think there's safe ways to exercise those. But now I want to be very clear with this. We can have church leadership say that. Governor Walz can implore you not to have communion or not to worship in a church. He can I don't care if he bullies you or belittles you or shames you for doing it, okay? But he can't legally say if you do it, it's going to be by penalty of law that you're going to be prosecuted. That is so dangerous right now, folks. And I know there's some people that are like, Tim, you're making too big a deal out of this. I go back to that if we can't stick to our fundamental principles now, what happens when no one's keeping their eye on it? I can't say it enough. These are very serious times that we're in for many reasons. But one of the most important reasons is that our very form of government, our very own free society, is very seriously on the table right now. Now, I'd like to think that rational people, especially when we get out of this, will steer us in the right direction. Okay? And I have a level of confidence that the people will step up and ensure that. But when I see us so willingly just deferring to a governor now at every turn and not challenging him or just letting him continue things, it causes me to worry a little bit that we aren't going to get this straight in the end. So that's all I have for tonight. I've seen some people have been posting, so let me look down there. Lily said, so sad to be witnessing this in my lifetime. People going to church getting fined. Yeah. So, folks, I kind of don't like being the super heavy. If you've seen my show in the past, I want to tell you what's going on, but I try to give you kind of the perspective, the both sides, this is serious, that's not as bad, or whatever the case may be. But these are very serious times. And I want you to be safe and be smart. There is a disease out there that we need to take seriously. But we also need to understand that in a land of the free and home of the brave, that we need to also take other things into consideration. And I'll wrap up with this. People have been saying, where are our leaders? And I'll let my constituents, and eventually I'll let history be the judge of whether I had strong leadership skills. But I will tell you, I'm going to attempt and I'm going to exercise leadership, because that is what we need now. We need people to step up, and I am going to step up. It's not always going to be popular. I've had people attacking me in the past couple of weeks for the actions that I've done, unfairly in my opinion, but I asked for it, so we're going to get that, okay? I encourage all of you to be strong, to support strong leaders, to support when good decisions are being made, okay? And to speak up, speak out, address your grievances to your government, because they will not take that away, okay? So you guys have a great week. I have session tomorrow. That'll be a little bit tough. I'm going into St. Paul to address my resolution, but then I'll be back. It has been a blessing to be around my wife and my son and my mother-in-law and my dogs. And if my mother-in-law heard that, yes, it's wonderful to be around her too. We've been having fun on Zoom with people. So that has been some of the good that's come out of this, as we've kind of reconnected with people in ways that we haven't in a long time. So thank you all. Thanks, Barb. Thanks, Lily. Thanks for everyone that is listening. Again, before I wrap up, if you haven't subscribed to this channel, subscribed. Let people know that this show is on here. I appreciate you being with me today. And God bless all of you, and God bless the United States of America. Bye-bye.